Hello, my name is Hannah Nicholson, and I would like to thank you all for joining me today. Today, I'm going to present to you a brief description of electronic medical record and several of the benefits for adapting EMRs to the growth of your facility. Over the past decade, electronic and digital technology has expanded immensely nationally and globally. With the advancements of electronic technology, electronic medical records have been developed to improve how data is obtained, analyzed, reviewed, and stored. This has altered the progress of medical technology by reforming and forever changing the processing of medical forms and records. Though some barriers of the EMR remain, health information is now made more available to health professionals and the quality of care served to their clients. Electronic medical records, or EMR, is defined as a collection of patient medical records in digital format. This systemized collection of health information is stored in an electronic and virtual warehouse. It is made available and accessible to healthcare professionals located in a variety of settings and areas. The digital format of the EMR has benefits that improve the delivery and collaboration of care given and provided in a continuously and dynamically changing health system. Much has contributed to the adaptation of the EMR. Though it is mandated by the federal government that every facility obtain access to the EMR by 2014, other factors have contributed to its meaningful use within the healthcare system as well. These factors include extreme advances made in medical computer information, both hardware and software technology, and a dynamic change in healthcare delivery system that is shifting from a volume-based practice to quality and value care. By the end of this presentation, I hope that I will have shed some light on the topic of the EMR. At the least, I hope I will have left a positive impression of the adaptation of electronic records and their benefits to our health system to help you choose effectively and most beneficial for your facility with moving forward. There are many benefits to the adaptation of digital formats of health records. The ones I will be discussing are areas of how communication is improved, benefits the EMR provides through data layout and presentation, and how the EMR provides multiple improvements in areas of safety and security. So, first we'll cover communication. The legibility of orders, prescriptions, and diagnostic findings can and is a problem to this day. EMR has improved this by providing legible electronic orders and prescriptions. Providers can place orders they want on a patient through electronic formatting. When they place an order, they are identified through the system as the order giver. This process can be the same, or at least very similar, for other departments and specialists. Communication is clearly seen and understood when legibility is understood, though some areas will still require dictation and transferring of something written to e-text. The EMR provides a step forward with providing standardized language and text. With sharing data, the use of paper charts requires information to be transferred physically from area to area. The EMR allows providers, specialty professionals, and mid-levels to all review the same information at the same time in different and various locations. If they have the security clearance, healthcare collaborative team members can have access to this information at a variety of locations beyond the walls of their office and facility. This will prove to be beneficial because most often different providers are treating different areas of patient health statuses. This information may now instantly be shared between professionals, further supporting a team approach. Instant results and order updates occur with the EMR. The EMR communication travels faster because it is made more readily available. Because the organization structure of whatever format is chosen, the EMR specific information may be more easily located. Additionally, even though a provider may be at a different site, they will have the ability to input orders, and those orders will then automatically and instantly transfer to the appropriate department which pertains to the order. Benefits of data layout and presentation are available. Instant data may now be reviewed. The EMR allows continuous and automatic updates of various health technologies. So let's say we are in a specialty care unit and the patient is connected to various monitors that collect continuous data such as vital signs, heart rhythms, medication administration. Well, this information may be entered into the system, and then the providers may instantly review the data even though they may not be at the patient's same location. The information is available in chronological order also, if the provider prefers, or any healthcare professional. This is a strong contributor to improved communication. The EMR has an organized display. Each department can have a way to enter and review specific data that pertains to their specialty and role within the patient's health. When the data is organized, important information is communicated in a more organized manner. This also reduces repeated diagnostic testing and can help plan for further or additional testing that may be needed. There is improved testing, scheduling, and result testing. Different departments such as physical therapy, nurse staffing, radiology, and even specialty departments can simultaneously review and input data in regards to their specific treatments, interventions, recommendations, and diagnostic studies. Departments can better collaborate cares and treatments for patients within certain time periods. Orders placed have specific times, and staff is able to plan more effectively with their other staff to reduce time spent waiting. Results of testing and studies are available for appropriate staff to review in a timely fashion that also plays a key role in the treatment of the patient. The last benefit I'm going to discuss is areas of safety. There are automatic warnings, alerts, and reminders for staff with the EMR. Patient safety should always be a primary concern. Prevention of any harm should always be actively in effect. Because of human nature, errors are commonly made and unfortunately may have costly consequences. The EMR is equipped to provide automatic alerts, warnings, and reminders that pertain to certain departments and staff. A study actually showed 54 to 87% of medication errors decreased with the use of the EMR and coordinating technology such as the EMR, or Electronic Medication Administration Record, and barcode scanning. Additionally, when a new medication is prescribed to the patient, the system may alert the physician and appropriate staff of allergies to certain medications the patient may have. Additionally, drug interaction warnings and reminders will be issued if the administration and prescribing of medications. So, for example, if a patient had, let's say, a CT scan done with contrast and the patient receives medication known as metformin that evening, well, the system will alert the medication administrator or the nurse of serious drug interactions. This just further supports and ensures patient safety. Or it ensures patient safety because it would stop the nurse from administering the medication. Other areas of safety include security clearance. Users are given security clearance that is dependent on their job description and license. Information is contained within a locked system secured by technology that limits those that see the information, elaborating on the protection of patient confidentiality. And lastly, backup and disaster recovering system is in constant effect. So the EMR has improved the physical security of health information. Paper records are at risk for many sorts of damage. Information may be stolen and or lost from misplacement or natural disasters. EMRs help evade such circumstances and situations because of security clearance, recovery systems, and electronic backups and safeguards. So, over the past decade, electronic and digital technology has expanded immensely. This has reformed the processing of medical forms and records, as well as caused a huge advancement in the progress of medical technology. Medical systems have benefited from the EMR by its improvements on communication, organization, and accessibility, as well as safety efforts towards patient safety, security of private information, and physical protection of the records. EMR should be accepted with efforts to provide constant feedback for improvement, growth, and advancements for the impending future of the collaborative health team. I would like to thank you at this time, and I hope that I have explained positive uses of the EMR that will help you make an educated and effective decision of how you plan to move forward with the advanced technology now available.